Ishpreet, you eating so slow today? Usually you finish before me.
It's nothing. I'm just taking my time to eat.
Are you sure or not? These past few times that we've been going out to eat, you've been making this ugly face.
It's nothing, just some chest pain. I've been getting it recently. Sometimes I feel like the food is coming back up.
Again? Ishpreet, if this has been going on for a while, maybe you should get it checked. You have been complaining about your chest pain every time we have spicy food.
Yeah, your taste buds are supposed to be in pain, not your heart. And didn't you mention that you have a family history of heart disease?
Nah, I'm still young and it's just heartburn. I'll take some antacid later.
I don't think it's that simple. Heartburn shouldn't happen this often. Remember I told you guys about my Uncle Jeff? He thought he was nothing, but it turned out to be something more serious. He had to change his diet completely.
Understand, but I can't give up my spicy ramen and kopi ice. And to see a doctor just because of heartburn, isn't that a little bit dramatic?
I mean, you don't want to end up like his Uncle Jeff, right? Better safe than sorry.
Okay. I'll go see a doctor then.
If you have been having this type of symptoms, you might be having a certain condition. Inform them about it.
Sure. These symptoms you've been talking about might be a condition called GERD.
What? What's GERD?
GERD, or Gastroesophageal Reflux Disease, comes with a variety of signs and symptoms that can affect everyday life. One of the most common and important symptoms is heartburn, a burning sensation in the center of your chest that often intensifies after eating, drinking, or when lying down, especially if you've eaten late. Another common symptom is regurgitation, where partially digested food and stomach acid flow back up into the esophagus, leaving a sour or unpleasant taste in the mouth. Chronic cough and hoarseness are also signs, as acid can irritate the vocal cords, leading to a rougher voice. Some people may notice excessive saliva, dental erosion, or gum recession, as GERD can affect dental health and is linked to an increased risk of chronic periodontitis. Other symptoms include nausea due to the relaxation of the lower esophageal sphincter, epigastric pain, or a burning sensation in the upper abdomen, and, in severe cases, difficulty swallowing, known as dysphagia, which can sometimes indicate a more serious condition. Recognizing these symptoms early can help manage GERD and reduce the risk of long-term complications.
What can I do if I have GERD?
Well, when you go to the doctor, they will first recommend you to alter your diet and eating habit. Since food and beverage like lemon and iced coffee are acidic, you have to minimize or avoid it at a certain time.
So I have to give up iced coffee?
It's not forever, just until your symptoms subside. You also have to avoid spicy food and overly oily food as well, as they are considered risky foods. Also, do you have big meals before bed?
Yes. Why do you ask?
Well, bigger meal increase the pressure on the lower esophageal sphincter. Your stomach acid reflux spread into the esophagus, especially when you lie down to sleep. Due to this, doctor will recommend having smaller meals and taking your meals no less than 3 hours before bed.
Oh, I see. Are there any other things that I should change in my lifestyle?
Besides avoiding risky foods, doctor may suggest limiting smoking and alcohol. Taking small but frequent meals can help improve your symptoms, and elevating your head via pillow will prevent acid from refluxing into the esophagus.
What if those lifestyle changes does not help our friend? What would be the other treatment option?
I'm sure Ashford will be fine. Don't jinx her.
I'm not jinxing her, I'm just concerned about her conditions.
In addition to diet and lifestyle changes, she will be prescribed some medication, which will be proton pump inhibitors. These inhibitors reduce the production of stomach acid by blocking the proton pumps in the lining of the stomach.
So, what are the other options if lifestyle changes and medications are not enough to heal her?
Who's jinxing Ishpreet now?
I'm not jinxing her. I just want to know all the options that she's had.
In the more serious cases, the patients will be treated via endoscopy. And if that doesn't work, then the patient will be recommended surgery.
Endoscopy? Surgery? What does endoscopy mean anyway? Like, why does it sound so scary?
Not to worry, only a small portion of patients will undergo either option. It's highly unlikely that you will be subjected to either option. It is a rare occurrence.
I'm so glad you wouldn't have to endure both of these options.
Me too. I'm so happy you won't have to suffer.
I know, right? But can you explain to me how endoscopy works?
Of course, the endoscopic procedure for this involves aiming radiofrequency energy to the lower esophageal sphincter. This is done to strengthen the sphincter, and it aims to prevent the acid from refluxing back to the esophagus.
That sounds painful. Will I be given anesthesia? How long is the recovery process?
Would she be required to get admitted? Don't worry, I will sneak you some nice food while you are admitted.
If I had to take an educated guess, I don't think she would be admitted.
Well, it is a minimally invasive procedure, but you will still be given some anesthesia. Most patients report being able to vary out daily activities within a few days of the procedure. It is a short recovery process, and no, people do not get admitted for this. It's called fundoplication because it involves wrapping the upper part of the stomach, called the fundus, around the lower part of the esophagus. This to strengthen the esophageal sphincter and prevent stomach acid from falling back into your esophagus. But do not worry, surgery only becomes an option when all other measures has failed.
I guess I should have visited the doctor sooner.
If you had visited the doctor sooner, your pain would have subsided sooner. It wouldn't have gone this bad.
Even though you have to avoid nasi lemak and ice coffee for a while, you can live it in moderation once you recover.
Do you have any questions? Many people mistake GERD symptoms for something they're not.
I've heard that heartburn might mean you have heart problem. Is that true?
GERD itself isn't usually life-threatening, but ignoring it for too long and can damage your esophagus, leading to more serious condition. So while it's not as scary as it sounds, treating it is definitely important.
I was told that if you avoid spicy foods, GERD will go away.
That's a common myth. While spicy foods can trigger heartburn in some people, GERD isn't just what you eat. Other factors like lifestyle habits and stress can contribute too.
So what should we do if we think we have GERD?
If you experience heartburn more than twice a week, it's worth visiting a healthcare professional. Simple things like adjusting your diet, managing stress, and taking medications as prescribed can make a huge difference.
Hi, I'm Casper, and this is my team member. We'd love to tell you, GERD isn't just heartburn. It can affect your daily life and lead to serious complications if you ignore. Recognizing the symptoms and making simple changes can make a big difference. So, don't wait and go see a doctor. Don't let heartburn steal your spot.